There's been a ton 19 this week. Janet DeMille to help us better. He's a medical officer of health. Dr. DeMille.
Thanks, Sean.
Thank you so much, as always. Top of your mind today.
One thing, I think there's a lot in mind. Certainly this week, new concern about another variant in the world that could as well. Comfortably high, and I am concerned overall holidays, and that could be certainly those that I'm thinking of.
There were 100 active yesterday. Were children?
I don't have a breakdown. I do know what I've like in the month. Pretty close were under the age of 19. Those were actually under the age of. I think that sort of we've been trending. So certainly seeing children and youth, but it's not just with them. Sometimes children, others, including the adults in their lives, seeing situations that.
Now, one of the at CBC is when we hear they're associated with this. The question is, are people above and beyond staff and students reported? Does it mean cases as Martin that they are exclusive staff or student brings home to the parents and that?
Yeah. So when I've quoted, and I've done this, send out to the school, the ones that are directly at school, and the ones that generally acquired the virus, and the majority are, and certainly in St. Martin's, vaccinated students because they're, I believe, just that grand total, so that are associated, and they spread it outside. They'll report on everyday contact included in the actual.
Now, what is drive cases over the fast few weeks?
So I think there's been a number of differences. So, I first we're just gradually. Some of that is due to something outside of the region, COVID back, and maybe spread. We did have those, and obviously into the school, elementary schools, where we're seeing, and both in the classes, and the kids are then passing it on to others, and the driver of our sped, let's say. Others is a big place where the virus is in house, and if they're getting to get another family, perhaps their friends, on to those friends, see the transmission of people to others. So maybe with one or two people, moving out to a large number of people, and then even a large number. So I think we all, kids and certainly I wrote in caregivers about the role that they play in screening, using the contacts of the school, for example. It's all of us that's happening, and all of us screening ourselves for said if that is indicate if we just have minor symptoms and waiting till we're going out, and that includes any people, we should be sort of not have any symptoms. So when you're out and about, maintaining that physicalness, if you're in an organization, if you are working in those measures and review that you're doing them properly at this time. If we don't spread this virus in a very difficult situation, days or after that.
A month and a half removed, we trace some urgent cases back to that.
That's always what you're alluding to is now is an collectively 2 weeks ago. At the time, is far enough away. Looking at the cases, the two, I don't think we really saw a link there. I think it was really about cases we didn't round at that time, and so it was there was less risk overall. I think what's happening right now is it's getting darker. We're not out, maybe we're getting together more. These could be maybe poorly ventilated, the spread of the virus inside.
A week and a half removed, 11-year-olds being able to get. How many have been vaccinated?
Success. I didn't calculate. We were close to not 40%, 20%. 5 to 11-year-olds received one dose yesterday morning. That was the number. 10 to 11,000. Yeah, 2,000 kids probably. Certainly, we are doing immunizations here at the Thunder Bay. We have who are also immunizing. First Nations are doing a lot as well, and so we're really seeing a reasonable like that. For kids and more appointment this week at the pharmacies as well. And
now, what's your protecting themselves as a society? We're still being tested, and about all of the things that's so contributing to a healthy society.
So when I'm in a place are following the rules, right? When shopping or such, or in other places, I do think, though, we are, a fair amount of evidence recency with people or workplaces, a lot of work with places, even if there's no cases. What we have seen together, as I indicated, in a private home, gathering, I've seen spread of the virus. And, I did parents and caregivers that went out a reminder to parents at school because we were seeing kids going to school contributed to some of them. So I think really I'm and if we become a bit complacent, it appears that with our would put themselves or others and to sort of rebuild in terms of getting back into I'm not sort of critically natural. We did have sort of natural to maybe so much, but this is the time where we kind of tighten, take those measures so that we don't situation ahead of us.
Canadian government has a variant that is making the world variant Bay, and if so, what?
So, and with things can move very. I think the truth is, without really seeing, and we'll see already prior to it being, this week. So, I believe I heard that there was. So it makes me even a little know that people have from areas, the district, and that is concerning. And all really do need to travel, especially to another turn here. Precautions to the virus back, that they're not spreading like Omicron, but even Delta spread very quickly. Really, that and you know what? I think it's easy to get rid of Omicron because there's a yet, and is very uncomfortable. Know the not good. Then live in. We're playing a little bit of it. We understand the real Omicron could play to our area. Once again, and travel and when we issued something about Minnesota yesterday, they easily bring it. You could potentially bring area like Omicron information on our website about what ourselves are or consider all at this time.
Talked about travel. This week borders have opened up. Late yesterday, ULEAS confirming that it's the non-essential travel.
Yeah.
What are part of you?
So I've always followed what's happened. Certainly, having some people crossing the border, and really vaccinated people do, because of the vaccine, some COVID, but some of the measures sort of seem. We were overall doing. Our numbers were well. I watch closely with people and other parts of the Centers for Disease Team data tracker. You can look through the different counties in Minnesota. You can county pretty much except one. It's deemed to be transmission, which is will rank something at actual numbers 10 times here. So even when you in Lake County or Cook County border, you could see Duluth having a case number and community transmission. I hear it, people go there. They do no public health measures that we have the masking, and they do have a bit of a lower. They have broader spread among people. Has always had, we have, and has topped through their measures, a bit more. So if you are Duluth, interacting with people, if you're at house, a much higher risk that you COVID-19 and then bring it back, or your workplace, wherever you may be.
Thanks for joining us.
Thank you very much.
Have a good day.
You too.
DeMille is the medical officer, Thunder Bay District Pandemic to help make sense. It is currently